Afternoon, folks. Thank you for being patient with us. It is a couple minutes past 2 o'clock, so we're going to get started. We know that folks will continue to roll in the next few minutes. My name is Kelly Talby. I'm the Director of Communications and Development at Kentucky Voices for Health, and welcome to our first official Thrive Kentucky program of 2025. This is a virtual program. We'll be covering state and federal policy landscape updates, which since our last regular meeting, I think a couple months ago at this point, a lot has changed. So you can go on to the next slide, Alex. For anyone who is new to the Thrive Kentucky Coalition, this is just a snapshot of who we are. These are some of our mission and vision-based principles that helps guide our work. We want fewer barriers. We want more accessibility, more affordability, a welcome mat, a no wrong door approach when it comes to every single Kentuckian, no matter who you are, where you live, your age, race, income, socioeconomic status, anything. Nothing should hinder your ability to have your basic health-related social needs met. And you can go on to the next slide. These are a snapshot of some of the logos you saw there on the welcome screen, as far as some of our steering committee members and those you'll be hearing from today as we go through each social determinant of health policy bucket, if you will. Go on to the next slide. And this is just some housekeeping. Today, we will try to answer, there's a handful of questions. Here's a few examples that were received prior, folks that submitted these through registration. And we encourage you to interactively ask your questions as we go through. We want to try to answer anyone's questions in live time. And I will reiterate this, but I guarantee that if you are thinking it, someone else is as well. So there's no silly question, there's no wrong question, there's no bogus, confusing questions. Please put those in the chat as you think of them, and we'll try to answer them so that the whole group benefits from the answer. If occasionally we will have topics that really kind of take off into a lot of chat discussions, and if that does happen, we will sometimes move on to the next speaker, but one of us will try to hop in the chat and still get those questions met. If you are here today and need continuing education or professional development certificates, CHW, social workers, targeted case managers, you name it, there is a required evaluation link that will be sent in the follow-up email that you'll receive from Alex Quintella. And yes, all these slides, links, resources, materials that we cover today will also be in that email as well. And one final housekeeping, it's not on here, but the room does grow often as the program continues, so just be mindful of your mic. We'll try to mute you if you come unmuted and there's dogs barking and cars honking, but try to be respectful of the large room. I'm going to the next slide. 2025 sponsorships. We would love to welcome you as a new sponsor in 2025, and hopefully within a couple of weeks, we can spotlight here a handful of some of our regular sponsors. But we travel the state, we provide snacks and print out lots and lots of materials for you all. And it's a team effort and one that we want to continue offering for free to our local community professionals. So if you're interested, that is my email there. Please let me know when you would like to chat, because I would love to talk about how we can spend your money wisely. Go on to the next slide. Here is the snapshot for our entire 2025 program. These are both virtual and in-person opportunities. And Alex will be dropping soon, possibly in tomorrow's email, I'm not sure, the landing page where moving forward throughout the year, you can find any sort of update as far as the exact location, the exact time, anything you might possibly need. Go on to the next slide. Here is the agenda for today. Pretty standard overview for each of the buckets that we try to cover. And when you get the slide deck, each one is linked. So if you were here today for a specific section, you can jump to that section in particular and save yourself some time. And with that, I'm going to pass the virtual mic to myself again. But go to the federal update slide where there's not a whole lot of anything. So before I get started, I'm going to use a tone of voice that I try to use often in my house. I have twin 2-year-old daughters, which sometimes, no matter how much love and adoration they receive, we're just blind with rage. So be it, you know, a busted lip or because they're hurt feelings because I wouldn't let them eat a twist tie, I try to take a tone of voice, kind of calms the situation. And I wanted to do that here for you before we pause and get into the federal updates because there's been a lot happening. So with that, yes, please, Alex, go to the next slide now. Here is what we know on a federal landscape. It's been a week since the Trump administration was sworn in. You're welcome, Marcy. On Tuesday, related to all health policy communications, President Trump halted those temporarily. And to be fair, that's probably a little honest of a reaction. Most administrations would probably want to review anything within its new administration that is kind of in the queue or pending. And so we're not alone in this. Kentucky is still trying to ascertain exactly what that means. Could it impact any sort of waiver that we speak to you all often about? Potentially, if there were communications that were still pending. But oftentimes, a lot of the federal communications are more routine. It could be related to hospital contracts and rates, things that are a little more just kind of process related and procedural in nature. One example of these memos can be found linked there in the first sentence. But please know that if you work for an agency, a CBO, anyone who needs to hear from CMS on a particular project or waiver or contract, we're kind of in limbo for the moment. Hopefully within a few weeks, we can give you a little more certainty on what that actually looks like for Kentucky. But right now, we really don't know, and we really don't know what that will fully impact. On the 24th, so that's this past Friday, there was a draft congressional committee agenda that was released that bulleted off quite a few proposed budget cuts that many news outlets and policy experts in the DC area had been rumoring and alluding to for many weeks. But now there's an actual official document in circulation that we can kind of look to kind of see where the direction of some of these policy changes might be heading. I want to make it very, very clear that the things bulleted off here, as well as what's linked in the full agenda landscape, is not for certain happening by no means. This is just their initial foot forward on what they would like. But as you know, just as in Kentucky on the state level and in on federal level in DC, so much there are many miles to go. But it's very important that we be paying attention since a lot of these changes will directly and at times very harmfully impact the Kentuckians we serve every single day. So what's actually on the table? These are bullets that are pulled directly from that document. The repeal of the family glitch fix. That was just actually fixed in 2022, I believe it was. Priscilla, correct me if I'm wrong on that year. Medicaid, SNAP, and TANF work requirements, and actually reducing TANF by 10%, which Dustin would rail me if I didn't mention how underfunded TANF has been since the late 90s. It's really been, like many programs, not actually supported to the financial stretch it actually needs in order to maintain itself. but this would be a direct and intentional 10% reduction. Eliminating broad-based categorical eligibility. If you all followed us this time last year, we were in the midst of a House Bill 367 fight, where at one point on a state level, eliminating the broad-based categorical eligibility was on the table, and it was going to be devastating, we knew, to seniors, children, Kentuckians with disabilities. It was really taking not even the right sledgehammer at the right gnat attitude. It was going to be the wrong sledgehammer at a caterpillar type of approach. And this is a federal elimination proposal for broad-based categorical eligibility. Also on the table is limiting Medicaid provider taxes, adjusting, lowering, and removing various components related to the federal medical assistance percentage rate. That is what you often hear us call FMAP, or the federal match. We'll talk a little bit more about that here in a second. Medicaid per capita caps. This is something if you've been around myself or Dustin or Emily or a handful of us the last few weeks, you might have heard us say out loud, this is essentially going to put a strict limitation for a certain population of people by individual on what the government agencies can spend, regardless of that individual's actual needs. And so if you really think about that and start to process how that could impact the people we serve, be that they're a child using K-CHIP, be it maybe they're an individual using a waiver, the range of need is really, really broad. And so to suddenly limit that in a Medicaid per capita cap could really be devastating and harmful to so many vulnerable families. Also on the table is ending SNAP and LIHEAP, capping the maximum SNAP benefit, which my colleague Jordan might have a few comments about during the food update. They want to reform the ACA's marketplace design, eligibility, and calculations process. These are potentially going to impact the thousands of Kentuckians who use our Connect marketplace for qualified health plans. There's a repeal to the nursing home minimum staffing rule on the table, and a lot more. These are some that I just cherry picked out because they're often topics that we do discuss with you. But please peruse this entire list. And again, by no means is this for sure what will happen tomorrow or even next week, but it is now officially what we understand to be their starting point on what they would like to propose. Dustin's putting some good comments in the comments there. You can go on to the next slide, Alex. So, because we now know this, you all have not seen this slide from us in quite some time. And it's updated and very important. If you have not made connections lately with your federal delegation, I strongly encourage you to do so. And I should have put an asterisk there by his name, but Congressman Guthrie in particular is a chairman of one of the committees where a tremendous amount of those proposed budget cuts have been assigned. He represents Congressional District 2, of course. Bowling Green, Owensboro, even part of Louisville is in his district, East Louisville in particular. So if you have offices, if you serve Kentucky clients in his district, please use your constituent power to reach out to him and elevate any concerns, ask him questions, make sure that our folks hear from you. And there's a link to one federal advocacy toolkit that we do have available. KVH and others are working on state level based advocacy resources to talk about the positive impacts and the breadth and reach of Medicaid and why it is so necessary and impactful to maintain for our communities. It's not that all change is bad, but sometimes we know that certain cuts will bring absolutely draconian, harmful impacts to many families. You can go to the next slide. So to kind of paint that picture a little bit, and these are just some of the low-hanging fruits. The map here was presented by Commissioner Lee to the legislature in December, so it's reflective of November's 2024 enrollment data. And while some of these stats may adjust over time, it is still true that 1 in 3 Kentuckians use Medicaid for their health care, 1 in 5 use Medicare. Thousands more access their health plan that's right for them through our Connect marketplace. And Priscilla, correct me if I'm wrong in the chat, but I'm pretty sure the last release I saw was that this was the second highest QHP enrollment that Kentuckians have gone through the open enrollment season that we just closed. Related to the federal match, revisiting any adjustments to the FMAP and why that could be potentially devastating, and we shouldn't take it lightly. It's easy when we talk about billions of dollars that if we adjust it just, a couple percent here or there, it won't be a big deal. No, it's a big deal. To put it in context, and we often refer to a 70-30 match in Kentucky, but that is not always the standard. Some programs, depending on what you're referring to, it might be a higher match threshold. But typically based on that 70-30 match, for fiscal year 24, the entire general fund for Kentucky, so the entire budget for Kentucky was $14 billion. Medicaid by itself drew $18.2 billion, 14.3 of which was the federal match drawn down. So the federal match that Medicaid drew into Kentucky was in fact slightly higher than the entire fiscal year budget. So I hope I explained that kind of in the numbers to numbers way to just really emphasize the reach and how impactful Medicaid is for every single family, every single community, every single county. There is not a county untouched in Kentucky by Medicaid's reach. 600,000 children, including 1 in 2 with special needs. Almost half of all births every single year are covered by Medicaid. We could keep going, and we do have materials in the works to help facilitate how we understand Medicaid's reach in Kentucky. And you all are acutely aware. You serve and work with the patients and the clients who use these programs. But just to paint how important and why we should not take any changes to the federal match or any other adjustments to Medicaid right now lightly, we need to practice extreme judiciousness and care and caution. Just wanted to put this picture out here for you. You go on to the next slide. So I'm going to start transitioning now and talking about the state level legislative landscape. Are there any federal level landscape questions that I missed? So on the state level, a few byproducts of the 2024 interim. You've heard Dr. Schuster present multiple times about the special task forces and committees. And I wanted to touch on these briefly first because they did conclude, sort of, mostly. We'll talk about the one there that's not linked. The Artificial Intelligence, Kentucky Housing, and Workforce Attraction and Retention Task Forces all finalized a memo of findings and recommendations that can be linked there and found. Actually, I had to call on the second one there, the efficient and effective school district governance, because I was a little foggy why I couldn't find their memo of findings, and it's because it doesn't exist. The only official recommendation that task force made was to continue its work into 2025, but there's a caveat there that it's not necessarily up to the task force of last year to make that decision. It will require either another joint resolution and act of the legislature and or LRC leadership after session concludes in March, making those decisions on whether it will become a 2025 interim priority. So nothing really to take action on here just yet. It will be a couple months before we know what the 2025 interim priorities will become. But for those who were following last year's special task forces, it's important to keep in mind those findings and recommendations, since often they will inform policy and bills to be drafted during the subsequent session, which we are now actively in. You can go to the next slide. So here are some bills of note on the state level. On January 7th, they gavelled in. We're currently in a recess or break. Neither of those terms actually feel right for this period. And this is a small list. It will grow significantly starting next week. The bill filing deadline for the Senate is February the 18th. The bill filing deadline for the House is February the 19th. They only filed about 260, 270 bills in that first week of session, which is kind of a little lower than what they could have done. So next Tuesday, February the 4th, until February the 19th, hold on to your butts because there's going to be a lot happening. But here are some bills that we have spoken about, started to track. You've probably heard some about in the news. House Bill 1 was a continuation on the state income tax reduction from 4% to 3.5%. If you recall from some of Dustin's presentations in the past, there are these triggers put in place, and this is just the next step. It's no different really than previous state income tax reduction bills. It's just another step in that march to zero. And while we still feel strongly that ultimately we might have to eat some crow on this, we've seen other states adopt these policies and unfortunately essentially bankrupt themselves and have to reverse and raise taxes again. Kansas is a unfortunately perfect example of that. But we shall see. There's many miles left to go here. It has become mildly popular, and the governor has indicated that he intends to sign the bill should they pass it. It was the only bill that really received movement the first week of session, and it is currently poised for a final reading and final vote in the Senate once they return next week. House Bill 16 is the fluoride removal from local water bill. This bill, if you've been following it, has kind of been getting a little bit of traction the last few years. And last fall in September, the California federal judge finally made an adjudication in a longstanding court case that kind of kicked the issue up again. That his opinion really essentially pushes the onus onto the federal EPA to do their job here. And he has said, okay, both sides, you've made your point. It is up to the federal EPA to put in place the efficient and safe standards for fluoride in water. Since we don't have that, we have it for other naturally existing elements, but we don't have that for fluoride. So let's do that. So we would practice extreme caution in encouraging the removal of fluoride preemptive of the federal government having an opportunity to do its job first. Our local water districts in Kentucky, especially in Eastern Kentucky, are already struggling. It's not something that should be taken and just removed, and then we regret that decision because maybe we didn't have to do that in the first place. We know about the value of fluoride, and we also know that we don't have the oral healthcare access necessary to meet our needs as they are. So anything that would exacerbate or heighten that as an issue, we definitely want to be very careful. House Bill 61 is the non-emergency medical transportation bill. If you've been following us for quite some time, we talk to you often about transportation, and you all are very well aware that it is one of the number one issues on why Kentuckians cannot get to work, school, or their healthcare appointments. For those using Medicaid, NEMT, while it needs a robust administrative reform, there are some statutory changes that could also be made that increases the number of providers. We think that schools and health departments and hospitals and those that are more incentivized to get their patients to their healthcare appointments should have a chance and a bite at that apple. So that is the NEMT bill, House Bill 61. Birthing centers are back, hopefully for a final time. Hopefully it will pass this year and we can just celebrate it for the rest of this year. But House Bill 90 and Senate Bill 17, sponsored by Representative Nemes and Senator Funky Fromeyer, again, respectively. Senate Bill 17 is actually poised to be heard in Senate Health Services next week. House Bill 90 will be heard in House L&O the week after that. They are identical in nature, at least at this time. And whichever one gets across the finish line first, we will welcome with open arms. House Bill 173 and also Senate Bill 59 there. Adrian might speak a little more in detail about during the housing section, but these are two housing bills to have on your radar. 173 would allow local landlord exemptions for the lead abatement enforcement policies that are nationally being heightened and emphasized. And Senate Bill 59 is a religious exemption for affordable housing developments. Senate Bill 13 is our perennial 3 MCOs in Kentucky bill. Usually this is just one that KVH kind of focuses on the most, but given that a years-long contractual dispute over the past Medicaid MCO contracts has finally concluded towards the last quarter of 2024, it feels like a ripe time to re-examine MCOs and that model here in Kentucky. And I didn't mean to skip one, but House Bill 203 and Senate Bill 35 are the abortion exceptions bills. Since 2022's SCOTUS ruling, you have seen these bills be introduced in some capacity to allow for rape, incest, and life of the mother exemptions to be placed in Kentucky, but neither have actually moved and made it past the threshold yet. Senate Bill 23, the last one to keep an eye on for now, is an additional extension on legislative autonomy and practicing their reach as far as the governor's ability for administrative regulations and executive authority overall. So not pictured here, prior authorization reform, anti-DEI, oral health care access bills that we know are in the works. And in fact, the majority of both the Senate and House Majority Caucus priorities, only House Bills 1 and 2 were filed, so 3 through 10 are still available, and all Senate Bills 1 through 10 are yet to be filed. So we do not yet know fully what the Majority Caucus's priorities will be. Next slide. This is just a reminder that all 2024 election winners have been sworn in. On the federal level, there were 9 new senators, 63 new reps, and 2 new non-voting delegates. For Kentucky, there were no federal delegation changes. So that previous slide, everyone stayed the same. On the state level, while there were 2 House members, Reps Rawling and Herron, who now are senators, as well as a returning House member, a veteran Mary Lou Marzian returning, there were still 22 total technical new members, 16 in the House and 6 in the Senate. You also are seeing some leadership changes. The entire House Minority Caucus leadership is new and have never been leaders in the past. And in the Senate Majority, there were 2 new changes, Max Wise as floor leader and Robbie Mills as caucus chair. Everyone else for the Senate Minority, House Majority, and the remaining Senate Majority are unchanged. Next slide. So I left this slide in here, but I tweaked it a little bit because there's going to be a lot of activity, again, on the federal level, state level, much yet to be seen, many miles to go. But this is not an election year. This year, your voice is so much more important than usual because we don't have a standard election to respond to. So please use your voice wisely. Please pay attention to the process. There are still opportunities for civic engagement and voter registration, of course, but because there's not an election year, sometimes the policies proposed will seem a little more bold at times. You can go on to the next slide. And so for those of you who wish to join us in Frankfort in any capacity, I encourage you to use our accessibility guide if it can be useful for you. be it a remote or in-person opportunity. This is supposed to be all the tips and tricks of the trade to get you around Frankfurt. And if we can ever be of service to you, if you see something that needs to be modified or changed, by all means, please let us know. But use this and help it guide your way as you navigate Frankfurt and reach out to policymakers on the issues that are important to you. And with that, I'm going to pass the virtual mic to Dustin Pugel.
Hey, y'all. I'm Dustin Pugel. I'm with the Kentucky Center for Economic Policy, and we like to start each of these off with just sort of an overview of where things are within our economy. I know to a large extent the degree to which a safety net is needed, things like housing assistance, food assistance, Medicaid, really depends on how well people are doing generally. So we like to start with some look at that. And especially this year, when we think that this notion that cutting the safety net may be some way of motivating increased work participation, we thought it would be a good idea to kind of take a look at what's going on there as well. You'll see here on the right, there's uh, a line around people not wanting to work anymore for every decade going back to 1894. So far from it being a new problem, I'm not sure it's a problem in general. It's just something that people, it's a common refrain. So let's move on to the next slide. I've mentioned this a lot, and I love mentioning it because it's great to start with good news, but Kentucky is still in the midst of a really historic run economically. During the COVID downturn back in, close to 5 years ago now, we lost 3 times as many jobs in 1 month as we did during the entirety of the Great Recession. Now, fortunately, because of a lot of federal intervention, things like the CARES Act and the American Rescue Plan Act and others, we really shot right back up. And then industrial policies like the Bipartisan Infrastructure Law and the Inflation Reduction Act have helped that continue. And so our trajectory is really strong. We actually now have 5% more jobs today than we did in February 2020 prior to the downturn. So things are moving in the right direction. So let's move on to the next. Now, while there is some conversation often about where our labor force participation rate is, particularly in relation to other states, I think it's important to look at what's called the prime age workforce. So these are folks between the ages of 25 and 54. So ideally, they're out of college and they're not quite into retirement yet. And if we look at what's been happening in the last several years, that population is also on a really significant rebound. We are at or close to the highest points in recent history in Kentucky. We have nearly 4 in 5 prime age workers in the workforce, which is right around where we were in the 90s and the early aughts when we were as close to full employment as we've ever been. After a brief and deep dip during COVID, we've really returned to our past. And this doesn't break it out by gender, but we're actually also pretty close to gender parity in work participation as well, which is something we haven't experienced very much in our state's history. So let's move on to the next slide. Now, there are folks who are outside of the workforce, right? If there are 4 in 5 prime age workers that are in, that means there's 1 in 5 that are out. Unfortunately, we have a survey that actually looks at why folks are not working. It's called the Current Population Survey. And it says that for folks who are prime age, again, 25 to 54 years old, the majority are either taking care of their home or family, they're ill or disabled, or they're going to school, or God bless them, they were able to retire early. That means that just a handful, 1 in 10, are either currently looking for work and they can't find it, or they're in some other category that the survey didn't catch. So there's a lot of there's a lot of good reasons why folks who are not in the workforce are not in the workforce. Only 21,000 were out because we didn't know. We didn't have the reason that they provided. So let's move on to the next slide. Now, what's interesting is if you look at the full population of working people, so everyone 16 and up, and you break it out by gender, what we see is like most folks are, retired. And again, that makes sense, particularly, and I'm talking about this in a minute, but particularly as the baby boomers age out of the workforce, that's going to become an increasingly large portion of our population. They're ill or disabled. or they're going to school. What's interesting is that when you break it out by gender, though, women are 20% of women who are out of the workforce are out of the workforce because they're taking care of family or home, whereas it's only 5% for men. And I know that there's a lot of sort of old stereotypes in that, but it's a reality. There is a lot of women who are taking care of a child, an adult dependent, or an aging loved one. So it's really important to recognize that while they may not be working for wages, they are working. They are providing an important service to the people of the Commonwealth. And some portion of them may want to be in the workforce. But generally speaking, that's a pretty significant portion of folks who are not currently working. Let's move it to the next slide. So I mentioned before that baby boomers are aging out of the labor force. This should be no surprise. There's been any number of think pieces on this. But if we look at the share of Kentucky who are ages 65 and up, 13.3% were 65 or older in 2010. We're now close to 18% as of 2023. In fact, retirees or people being out of the workforce due to retirement is becoming an increasingly large share of reasons why people are out of the labor force. Fortunately, people who are ill or disabled being out of the workforce is decreasing. And there's a lot of reasons for that. There are actually an increasing number of employers who provide accommodations to people with disabilities now than there were a decade ago. The rest of the reasons for being out of the workforce are pretty stable, including the two least likely reasons, which are they can't find work or they're out of the labor force for some other reason. So let's move on to the next slide. So I mentioned disability as a primary reason why people are out of the labor force. It's the second most likely reason. And the reality is that Kentucky has the second highest rate of disability in the country after only West Virginia. And the CDC actually breaks out what types of disabilities disabled Kentuckians have. The largest portion have some sort of cognitive disability. The next largest group are people who have some sort of mobility disability, either they're paralyzed or they have some other mobility impairment. And the rest are people who have difficulty with independent living. That's one or more activities of daily living, brushing teeth, eating, getting your clothes on, using the restroom, things like that, hearing and vision, and then self-care. So let's move on to the next slide. Another really important thing to point out, and this is really surprising to me, but there's this conversation about sidelined workers, and they being our legislator, they point to our labor force participation rate as a clear indicator that we have a problem with people not wanting to work. What's interesting is if you break out Eastern Kentucky from the rest of the state, what you have is the balance of the state having a workforce participation rate that mirrors the rest of the country. In other words, when you take out Appalachia, which has a long history of underinvestment, of dried up sort of monocultured economies that are extraction based, and significant depression when that one sector of the economy went under. If you take that out from the rest of the state, Kentucky is doing really well. And so what we have is not an issue where we have lazy workers or we have people who want to stay home. We have a situation where we have a significant economic headwind that needs investment, that needs attention from our legislature, and they need supports as well. So let's move on to the next slide. And we know that people across the Commonwealth need supports. So it will be no surprise to folks on this call that it's hard to get by in Kentucky and anywhere else in the rest of the country. This graph is one that I really love showing because it really demonstrates how difficult it is to make ends meet in Kentucky. If you look at the yellow dotted line across the graph, that's the median annual earnings for a full-time year-round household in Kentucky. It's just shy of $60,000. As the bars in this chart get darker, that demonstrates more children. So the first set of bars is one adult. The second is two adults, but only one working, so the other one gets to stay home with the kids. And then the third set of bars are both adults working, which frankly is the majority of households in Kentucky with children. And what you'll notice is that as soon as you have kids, it's very difficult to get by. We're going to talk a little bit about this later, but you have to start affording childcare. You have to afford more rooms in your home. You have to afford better transportation. You have more mouths to feed. And so this is where I think it's really important that we acknowledge the role that the safety net plays, particularly in supporting families with children. And they're the ones who typically are also toward the bottom of their earnings trajectory. They're not earning as much as somebody who's later in their career. And so they're the ones who need the most help. Feels like a pretty common sense thing to say, but it's, I think, important to point out. So with that, let's move to the next slide and transition a little bit into our main tool for supporting Kentucky families, and that is our state budget. Let's move to the next slide. I often say that the budget is a moral document. It's a statement about what we value. And if you look at the top line numbers in our state budget, and this comes from the Office of the State Budget Director, I think we value some really good things. So the largest portion of our expenditures as a state is P through 12 education. That's both our basic funding, but it's also things like learning and result services, which includes teacher healthcare, and also teacher retirement. So it's a pretty big bucket. It includes a lot of different things, but I think that's a really important thing to be investing in here in Kentucky. The next largest categories are things like Medicaid, which covers 1 in 3 Kentuckians here in the state. Criminal justice, that's all kinds of public safety expenditures, plus any sort of incarceration that we pay for. Post-secondary education, that's all of our public universities and community colleges. And then other human services. So again, think of things like the community mental health centers, public health, childcare, and then about 12% is everything else. So everything else state government does falls in that bucket. I think those are some really good things. And our state budget, I think, allocated our resources accordingly this last session. Let's move to the next slide. Interestingly, though, there was a second part of the budget this year. So our budget is typically one document. It includes operational expenses as well as what's called the capital budget, which are one-time projects, things like new schools or purchasing for new fleets if the state needs new vehicles and things like that. This time, though, they separated out those one-time expenditures from the typical budget, and they created a whole separate budget. Actually, it was in a couple of different bills, House Bill 1 and Senate Bill 91. Out of that, they used $2.9 billion from what's called our Budget Reserve Trust Fund. Sometimes it's called the Rainy Day Fund. It's essentially our state savings account. And they funded hundreds of projects. Some were statewide, but most were local projects in communities. Interestingly, it also included $62 million in operating funds for Medicaid. They found a shortfall in the standard budget in Medicaid, so they added money into the separate sort of budget reserve trust fund funded thing to do that. So why have a whole separate budget when we typically have one? Well, this budget was exempted from the triggers that Kelly mentioned earlier that the General Assembly uses to pass income tax cuts. So you'll see here on the side, they specifically exempted these expenditures because they needed to move the goalpost in order to continue cutting our income tax. So let's move on to the next slide. So the income tax is a really significant portion of our budget. Up until we started cutting it, it was actually the largest and fastest growing portion of the way we fund state government. And cutting it, however, really goes to benefit wealthier individuals. So nearly 2/3 of the benefit of the income tax cut goes to earners making 6 figures. 20% goes to folks earning $1.4 million on average. The poorest Kentuckians, which is about 1 million people here in the state, they already don't pay an income tax. So our poorest neighbors have absolutely no benefit from reducing the income tax. It's really just folks who are already doing really well who benefit from that. So let's move on to the next slide. Now, I mentioned these triggers earlier. While it is true that wealthier Kentuckians benefit from it, one of the ways in which those triggers operate is that it requires that the General Assembly underspend every year. They're supposed to not spend about the equivalent of a 1% reduction in the income tax, which is a little over $1 billion. And this chart shows that's exactly what they've done over the last 5 fiscal years. This most recent fiscal year, not so much. But What that means is that with all of the needs that we have, with things like the housing shortage, with the child care funding cliff, with increasing medical needs here in the state, the General Assembly chose to take $1 billion or more every fiscal year and put it into a savings account. And that's a problem, I think, in a lot of ways. Those are things that we really need. It's also a temporary surplus that was driven by federal aid and inflation. And so, while I think it may be responsible not to spend all of that in continuing operational expenses, there are certainly things that we need right now instead of permanent tax cuts that are going to forever create a dent in our ability to make ends meet as a state. So let's move on to the next slide. And it's going to make a significant dent. So if you compare the value of going from a 5% income tax, which we had prior to this reduction cycle, down to 3.5%, that may not sound like a lot. And to you and I, we probably barely notice that in our paychecks, but it's representative of about $2.1 billion. That is almost as much as we spend on the entirety of the Medicaid program as a state, our state portion of that. It's more than we spend on the what's called the SEEK-based funding, which is the core funding formula that we use to support our public schools. It's twice as much as we spend on all of the public schools, universities, and community colleges in the state. So it's a significant amount of money that we will no longer have moving forward that we had up to this point. And I think it's important to realize that there is a direct trade-off to reducing our income tax when it comes to being able to afford the things, the goods and services that primarily benefit lower income Kentuckians, but in truth benefit us all. So let's move on to the next slide. It's also important to note that the dent that I mentioned is already showing up in our revenue. So this shows year over year changes in our what we bring in as a state in order to be able to afford things. And you'll see there for a few years, particularly following the pandemic, when federal funds were still floating in the state, when inflation was high, we saw a pretty significant increase in our revenue. But now for 3 fiscal years in a row, we've actually seen a decrease. And now the Kentucky Budget Office is expecting over a $200 million shortfall this fiscal year. There have only been a handful, about 3 other times in the last 50 years that the state has faced a shortfall. And in all 3 of those times, it was during a significant recession, including the Great Recession when it happened most recently. We're not in a recession right now. We're actually in one of the most incredible economic booms in our state's history. So for us to be facing a shortfall now is especially concerning if, say, in the next couple of years, we do face a downturn. Then we're going to have to make incredibly difficult choices about what we're willing to pay for. All right, with that, let's move on to our next section, which is childcare. So childcare is one of the things we pay for in the state budget, and it's also an industry that supports every other industry in the state. It's not only important for our economy, it's also, research has shown, when we provide high quality childhood education, we ensure that those benefits ripple out through their lifetime. Some estimates say that for every dollar invested in childcare, we have $7 worth of sort of public goods in the rest of the economy. So let's move on to our first slide here. So when I mentioned it's good for the economy, obviously the most direct way that it benefits the economy is by allowing parents to go to work. So, I was mentioning earlier how many women are out of the workforce because they are caring for a loved one. Well, there still are many women in the workforce and men because we're able to provide this. Even still, the workforce participation rate for women is much lower than men, particularly among mothers of young children versus fathers of young children. 1 in 5 Kentuckians who are prime age have a child at home between the ages of 0 and 5. And 1 in 3 Kentucky parents have had some form of employment disruption due to difficulties with their child care provider. I'm one of those. I've certainly experienced disruptions in my employment because I've had a child care center shut down for a few days, or I've had to find new child care. It's certainly an experience I think a lot of us can relate to. So let's move on to the next slide. Oh, can we go back one real quick? No, okay. So one of the reasons why childcare disruptions happen is because childcare is very difficult to afford. So recent estimates have shown that for in Kentucky, a toddler in a center-based childcare setting, it cost a family about $9,200 a year. Now, remember, these are younger parents. They're at the beginning of their earnings career. They're not able to save up for childcare prior to having a child, the same way that a parent later in their career might be able to save up for, say, college. And yet, childcare is more expensive than some college educations. So full-time at KCTC costs a parent about, or student about $5,300. Full-time at EKU is about $10,000. So that's really difficult. And yet that's for the kind of quality that we currently have. Only half of childcare centers in Kentucky are high quality, meaning that they have 3 or more stars on the all-star rating. The higher quality you get, the more expensive the childcare is. And that's where we see a lot of the longer term benefits. So let's move on to the next slide. Even if you're able to afford childcare, it's not easy to find. So over the last 12 years, there's been a 45% decline in the number of childcare centers that are here in the state. That's about almost 1,700 fewer childcare centers. So, there was an initial moratorium during the Great Recession that really damaged the ability of a lot of childcare centers to stay open when they were getting fewer and fewer children with CCAP, and their parents certainly couldn't afford market-based rates. But that stabilized somewhat during the downturn, interestingly. COVID funds amounted to about $1 billion here in Kentucky just for childcare centers. And that created stability that we hadn't experienced in a decade here as a state. And we're still experiencing that to a degree. So let's move on to the next slide. Now, childcare being difficult to find, I think, is again, something that we can all relate to some degree. KY Stats, which is a government institute here in Kentucky, did a really interesting study on drive times to the closest childcare center. So the red shading has to do with the workforce participation rate, but the green shading shows areas around childcare centers where it takes 10 minutes or less to get to a childcare center. You'll notice that some places in eastern Kentucky, notably Martin County, doesn't have that at all, and that's because there are no childcare centers there. So there is a significant difficulty in finding or accessing childcare, let alone affording it. So let's move on to the next slide. Now, you've heard us mention before that there was a significant amount of federal money that went to childcare centers. It was $1 billion here in Kentucky. That money ran out. And so childcare centers, or the ones that we do have said, this is going to create problems for us. If the state doesn't step up, we're going to have to do things like raise tuition, which we've already seen is unaffordable, cut wages for our staff, which I'm going to talk about here in a minute, lay off staff, or potentially close our programs altogether. Fortunately, so far, we haven't seen a lot of program closures, but we've seen a lot of tuition increases. Childcare has become radically more expensive now than it was a year ago. And that's something that we're watching, but it's also something that the General Assembly tried to step in and address. So let's move on to the next slide. Oh, real quick, this is probably out of order, but it's important to note that even if childcare is expensive, which it is, it still doesn't cost enough to be able to provide reasonable wages to the people who work there. So KY Stats did a separate look at the workforce within the early childhood sector. And what they found is that for folks who have a bachelor's degree in early childhood, they're only earning about $26,000 a year. If you have a family of 4, that's a poverty wage that you're earning with a bachelor's degree. If you have a master's degree, you're earning around $52,000. Most of those folks are going to be either childcare directors or owners. And so they're naturally making a little more. If you have no reported educational attainment, which is frankly the reality for a lot of childcare classroom teachers, we're talking about extremely low wages that are low enough that you likely already qualify for CCAP, let alone other types of benefits. The result of this is that childcare centers experience a very high turnover rate. So between 2017 and 2021, there was a turnover rate of over 46%. That means 46% of the workers in the childcare sector left their place of work, and someone had to hire for that position. That's very disruptive, not only for the business, but also for the kids who are in those centers, who are looking for stability from their teachers. And that creates a real problem when it comes to quality. All right, let's move on to the next slide. So the General Assembly did do some really helpful things for childcare this last year. They provided more money than we've experienced before as a state in general fund dollars, but it wasn't enough. We lost around $330 million a year from the federal government, but we only received close to $70 million per year total, which is a really steep decline and has resulted in a lot of things that we just mentioned. All right, I think I have one more slide. We mentioned things like how much Kentucky puts in for public education. If you compare the two, I think there's a really strong case to be made that we are woefully underfunding childcare. 90% of brain development happens in all of us between the ages of 0 and 5 years old. And yet we're only funding around $327 per spot during that portion of our life right now. The other 10% of brain development happens after that. And, to make a comparison in education, we're funding around $4,300 per student through SEEK, which is the P through 12 or the K through 12 formula. We've got a lot of room to grow, and I think there's a lot of opportunity for us to be able to provide for our youngest folks. So with that, I'm going to hand it over to Jordan.
Yeah, let's speed run some jargon heavy food policy. So currently, based off of the MAP and Meal Gap data, which is the Feeding America national study released each year, this most recent year, we got our first glance at how hunger evolved over the pandemic. And as of right now, there are 710,000 Kentuckians facing hunger, with 1 in 5 children that are food insecure. The average meal cost rose sharply, understandably, over the pandemic with inflation. We also have the second highest rate of hunger, ages 50 through 59 in America. And in Kentucky's largest city, Louisville, there are 1 in 5 folks living in a food desert, which obviously is correlating to the 710,000 folks across our great Commonwealth that are going without consistent nutrition. There are 43 counties in Kentucky that have persistent poverty, and there are 4 counties in Kentucky that rank in the top nationally in food insecurity and poverty levels. As you can see in the graphic with the green highlights, the 47.3% through the 59%, illustrating which counties those are specifically. So what we noticed over the pandemic is hunger plummeted in 2020 and 2021 as the government implemented supports for poor Americans. And then once they deemed that the pandemic was over in 2022, there is a sharp increase in hunger rates as they rolled back those supports. Next slide, please. Right, so we have quite a few ways that we like to combat hunger in the United States. The first one, SNAP, the Supplemental Nutrition Assistance Program. For gross income to qualify, it has to be 200% of the poverty line, net income 100% of the poverty line. U.S. citizens and some legal residents of the United States may receive SNAP benefits. Non-citizen parents can apply for benefits for their citizen children. We'll see how this changes over the next couple of years, obviously, as immigration continues to be a hotly debated subject. Its companion program, Women, Infants, and Children, WIC, you can be a pregnant, breastfeeding, or postpartum woman, or just simply the caretaker of a child under the age of 6. And you receive grocery benefits as well. Both of these programs are some of the best programs we have, especially when it comes to return on investment for our economy. The amount of revenue that it generates locally, it's federal dollars coming in to local places. You have mom and pop shops in Appalachia that are being kept afloat right now from their residents that are spending their SNAP dollars at the grocery store. So these are very vital programs economically, but also they help families save on grocery money until such time that they can graduate off this program. Our best estimates right now are that the average Kentuckian on SNAP spends less than 6 months. So you'll hear a lot of rhetoric from some folks about how there's cradle to grave dependence, but we're not seeing that with SNAP. It's harmful rhetoric. It does a lot of damage to those on it, and is used to validate attacks on these programs. And we need to dismantle those pieces of misinformation in every turn. We also love feeding kids at school. It's one of the best social service engines we got, the National School Lunch Program. We have categorical eligibility if you're eligible via SNAP, Medicaid, KTAP, Head Start. The wonderful community eligibility provision, which I know is a jargon-dense acronym right there. The simplest way to explain it is we're able to give an entire school free meals based off of the percentage of their students that are eligible for other low-income programs. Kentucky's current CEP rate is set at 40%, meaning if 40% of a school is on one of these low-income programs, and the entire school gets to eat for free. So we love CEP. It simplifies the job for our nutrition directors and goes a long way to feeding Kentucky's children. The Summer Electronic Benefits Transfer Program, otherwise known as Summer EBT, you'll sometimes also hear it referred to as Sunbucks. Households with school-aged kids over the age of 6 participating in the National School Lunch Program, and also for kids under the age of 6 enrolled in SNAP. When you are a parent and your kid is out of school for the summer, it is often really difficult to put meals together for them if they're not eating for free 2 meals a day. So Summer EBT is meant to meet that difference and to help those parents survive those 3 months and to where they're not drowning with a much bigger grocery bill. So next slide. Let's keep on chugging. Summer EBT ended for 2024. It provided money during the summer to address seasonal food insecurity. It provides about $120 per child to an estimated 580,000 children in Kentucky. Keep that number in mind as we also talk about 1 in 5 kids in Kentucky going hungry. There is a gap with all of these feeding programs between the number of people who need to be on them and the number of people actually participating. So in these discussions, we also need to factor in that these programs are critically underutilized, and we need to increase registration if at all possible to help meet the growing need. For summer 2024, households with kids receiving SNAP, Medicaid, and KTAP received benefits. Students between the ages of 6 and 18 that participated in free or reduced meals during the last school year were able to apply online in August. 2025 will be slightly different. They'll receive less money. It'll go from $120 per student to $40 per month per child. But for some families, that may shake out a little bit differently. And from 2026 and onward, $40 per month per child as well. Next slide, please. So monthly SNAP participation has altered over the last 20 years, as you can tell, and I'm sure in the next 3 years, it'll change even more. So the average SNAP benefit for an individual is $174, and for a household, it's $370. But how household is determined depends on where you look. So the total SNAP participants as of June of last year was 617,000 families. Or 617,000 individuals, excuse me. Keep that number in mind when we also compare to the number of families on summer EBT. So there's a disparity, there's a gap. Not everyone who can be participating is participating. The percent of Kentuckians participating in SNAP as of June was 13.7%. Our best estimates are around 15 to 17% of Kentuckians are going hungry. So 2-3% of Kentuckians who are food insecure are not able to get grocery money. There's money being left on the table. SNAP benefits in Kentucky as of 2024 amounted to about $1.2 billion. That goes a long way for our local economies. And Kentucky is 46th in the nation for SNAP participation rates. We're ranking near the top for hunger and towards the bottom for participation in federal programs to help the hungry. Next slide. So exemptions for able-bodied exemptions, yes. So 3 new exemptions started in September of 2023. People experiencing homelessness, people aging out of foster care, and veterans. There are existing exemptions under 18 and over 54, children in household or pregnant individuals. You can also live in an exempted county, physically or mentally unfit for work, caring for an incapacitated person in the household, substance use treatment, etc. So work requirements did go back into effect. Reporting requirements went back into effect in 2023, but there are exemptions, and ABODs continue to be a hotly contended group when there are restrictions legislatively being discussed. Next slide, please. So there are a few counties that are exempt from the SNAP time limit, or at least were. So as you can see here, the greens were those that did have waivers, the newest additions, and then largely concentrated around the Louisville area and the Central Kentucky. They have no waivers when it comes to the SNAP time limit. Go to the next slide. Another way that some folks like to attempt to restrict SNAP is by going after various critiques. For example, the work requirements, but also fraud is a often discussed point to justify restrictions. But the total SNAP fraud rate is less than 1/4 of 1%. I'm getting notification that my time is almost up, so pardon me as I coast into the remaining slides. And EBT card skimming replacement ended in October. So folks who got their benefits stolen by fraudsters are no longer getting their benefits replaced. And we are fighting tooth and nail to get that into a piece of federal legislation to restore much needed grocery money for Kentucky's most vulnerable. So making this a federal priority is our next step. Next slide, please. WIC helps to feed pregnant or breastfeeding women, infants, and or children under 5. And total 2024 participation as of April was $106,000. But the average monthly benefit is only $43, much less than SNAP. And as a reminder, kinship care, fathers and grandparents can still apply, even though women is in the title. It is not restricted to just women. Next slide, please. And if you need resources beyond safety net programs, please, I work for Feeding Kentucky. I'd be happy to connect you with any of our food banks or partner agencies and or pantries. And then, of course, there's federal program assistance. We've got some lovely SNAP connectors who'd be happy to connect you with various safety net programs. And there are websites included on these slides if you need resources around senior meals or someone else you know who would love to be able to apply to one of these programs and get some grocery money back in their pocket. Next slide. And then, of course, please join in on the Kentucky Food Action Network if you are passionate about feeding opportunities and want to lend your voice as an advocate. Next slide. And handing it off to my lovely colleague, Adrienne Bush.
Thanks, Jordan. All right. Adrienne Bush with the Homeless and Housing Coalition of Kentucky. Glad to be with you all. Next slide. We'll start with the federal updates. And what we know during a time of huge change, as Kelly talked about, we have a couple of cabinet nominations that I just wanted to highlight for you. One is Scott Turner for the Department of Housing and Urban Development. Another is Brooke Rollins for USDA or agriculture. And the reason we talk about these is because there are housing programs in both departments, if you will. Both have had confirmation hearings, but they haven't had a full vote in the Senate yet, but we expect both to be confirmed. In the meantime, we still are operating under a continuing resolution through March 14th, kind of hurtling toward that. And to the extent that we do have housing assistance, it is dependent on Congress keeping the budget and the appropriations process going. And then I thought Kelly did a great job kind of outlining the menu of potential cuts that the National Low-Income Housing Coalition alerted us to, detailing the up to $5 trillion in potential cuts. Next slide. From the state legislature's perspective, we are coming out of the interim with the Kentucky Housing Task Force and some legislation from members who were on that task force, including Senator Jimmy Higdon, Republican from Lebanon, as well as Representative Susan Witten, a Republican from Louisville. Senate Bill 59 seeks to streamline planning and zoning requirements for religious institutions to develop affordable housing, to make it easier to build housing, say, in God's backyard. House Bill 160 seeks to establish parity in local zoning requirements for manufactured housing versus traditional stick-built single-family housing. So we will see as these bills progress, how it goes. We have some bills that will propose additional barriers. One has already been touched on, and that is House Bill 173. It would preempt local governments from operating rental and lead registries. Both housing registries are important for people to know who they're renting from, that it's safe, that it's decent, that it meets basic code. And we also know that lead poisoning is a real problem for, in particular, small children and extremely elderly folks. And we think that, since our lead-based paint law was passed in 1978, we should try to ensure that our housing is free of lead-based paint and lead pipes moving forward. Everybody deserves safe and healthy housing. Next is House Bill 18, which is just a local mandate that would require additional requirements for multifamily and accessory dwelling units in terms of planning and zoning. And while we need to be building more, this would be putting up additional barriers. Next slide. Some other bills that relate to homelessness and housing. One is House Bill 58 that says if you have a health emergency that you need to go into the hospital or the nursing home for an extended period of time, you can terminate your lease under certain provisions. It's similar to the leasing protections that we have for victims or survivors of interpersonal or domestic violence. House Bill 109 is curb law, and that is just saying if someone is evicted or has to leave the property suddenly, a landlord can't just toss all of their items out on the street. House Bill 186 would streamline regulations on potential food donations to emergency shelters. And Senate Bill 32 would in part direct the Kentucky Department of Veterans Affairs to end veteran homelessness using evidence-based practices. Senate Bill 34 would in part create new sections of KRS Chapter 141 to establish an income tax credit for a taxpayer who rents a residential unit to a protected tenant and allow an income tax credit for the conversion of condemned property into a domestic violence shelter. Last two are by Senator Yates out of Louisville. Next slide. All right. So when House Bill 5 passed, we sought to monitor its impact, knowing that a law that would provide for fines and fees and jail time for people who are sleeping outside when there are no shelter options available would result in very just inhumane occurrences. And over the winter, we found something that was pretty inhumane and that we think that Kentuckians should be aware of. That under House Bill 5, we had a woman in Kentucky, in Louisville, who was cited for street camping while she was literally in labor and delivered the child that day, the same day that she was cited for street camping. Her court date was supposed to be in January. And in the meantime, she is, with the help of an attorney, filing a legal challenge under the Kentucky Constitution. So we will see, and we will keep you updated as this case progresses. And with that, next slide. We do have some other state updates. One is around the Inflation Reduction Act implementation. Kentucky is beginning a Kentucky Energy Rebates Program. And so you can click on the link when you get the slide deck and learn more about that. to really help energy efficient, make homes more energy efficient across the Commonwealth. Again, we'll see. We also wanted to share with you that the Community Development Block Grant Disaster Recovery implementation in Eastern Kentucky, that continues, and that folks who were impacted by the 2022 floods can apply for housing assistance, for new housing, for home repair at the link Housing Can't Wait. And then lastly, just wanted to let folks know that the annual point in time count of people experiencing homelessness is happening this week. There is a count that happens in the balance of state in different communities across Kentucky. There is one in Lexington, and there is one in Louisville, and this is done annually to help analyze trends of unsheltered and sheltered homelessness. And with that, I believe I can pass it on to Dr. Schuster. Thank you.
Thank you, Adrienne, and hello, everyone. I'm Sheila Schuster, a licensed psychologist representing the Advocacy Action Network and Mental Health America of Kentucky. Next slide, please. Just a reminder that the things that we think of as social determinants of health are also the social determinants of mental health. Our motto is mental health is health. So the same things apply. So we call those also health-related social needs. That's the newest terminology. So unemployment, food insecurity, poor access to quality health care, all of the things that we've talked about here and that Thrive works so hard to make communities free of these scourges. All of those things obviously have an impact on the individual's health and also their mental health. Next, please. So I want to talk for a minute about behavioral health Medicaid waivers. You've heard me, if you've been on these before, we've never had waivers that really focused on people with mental illness or substance use disorders. And we are finally making some headway there. So we are working on providing supported housing and supported employment to Kentuckians with severe mental illness. And we were hoping, praying that CMS would approve this before the change in administration in Washington, but they did not. So it is still sitting on someone's desk. I hope there's someone there at the desk at CMS to sign off on this. If it gets approved sometime soon, we're waiting, looking for a July 1st start date. The other one that has been approved and is being rolled out is a very exciting waiver called the Reentry Waiver. It deals with Kentuckians with mental illness or substance use disorders when they are incarcerated. And instead of suspending Medicaid, we will be giving them Medicaid services 60 days pre-release, hooking them up with their MCO so that there's a smooth transition into the community. The waiver is starting with youngsters in Department for Juvenile Justice facilities and also in the state prisons, but we are very much hoping that they will start working with the local jails to also serve those folks. So stay tuned. There is a TAC that meets every other month starting in January on the second Thursday of the month at 9 o'clock that talks about reentry, and you can find that information on the DMS website. Next, please. We also talk frequently about the 1915C Medicaid waivers. Those are the ones that most people know about because they deal with people that have developmental, intellectual, or physical health needs, and they are called the home and community-based waivers. We did a fantastic advocacy job in this last General Assembly, and we were budgeted for 1,925 new slots. I hate that word, but new 1,925 more people could be served in these waivers. However, the waiting list continues to grow and it's now over 13,000 people currently. The other exciting thing that's happening is that CMS is requiring every state to start a beneficiaries advisory council. It's going to be called the BAC, and it will be made up solely of Medicaid members, parents or family members, and caregivers. And after 2 years, members of that group will make up 25% of the Medicaid Advisory Council, or the MAC. So look for information through KVH or through Advocacy Action Network about the legislation when it gets filed, and then how they're going to set up applications for membership. This is a great way to be an advocate if you are connected with someone who gets Medicaid services. Next, please. Want to pay attention to the mental and physical health of our LGBTQ students. You will remember that in 2023, despite our best efforts, Senate Bill 150 passed, and it negatively impacts the physical and mental health of all LGBTQ students in Kentucky. We know that because of the restrictions on communications using a preferred name or pronoun, and even teaching students about safe sex and other kinds of things, the schools are much less safe and supportive. And trans kids are now being required to use separate bathroom facilities. That just adds to their disenfranchisement. It's much more difficult for trans kids to access mental health treatment. Now, the good news is that Governor Beshear went on and signed an executive order banning the negative practice of conversion therapy in Kentucky, thus protecting LGBTQ kids. That was this summer. The bad news is that Representative Josh Callaway has filed HB 64 to overturn that executive order. So we really need to be reaching out and fighting against that. He also, unfortunately, has filed House Bill 154, which would prohibit payment for physical or mental health gender-affirming care. Mental health professionals were not included in Senate Bill 150, so this goes even further than that disastrous legislation. So again, we've got some things where we're really going to have to exercise our advocacy. Next, please. Kentucky does not do very well in terms of our suicide and self-harm statistics. In almost every category that you can think of, in terms of age groups, in terms of gender, in terms of race or ethnicity, we're seeing increases in self-harm and suicide statistics. Our farming communities are very much at risk, but we have a wonderful Kentucky resource that can be found at raisinghopeky.com. There's a lot of stigma in the farming communities about talking about mental health, and they're doing a great job of starting with the youth that are involved in farming, with the Future Farmers of America and with the 4-H. Again, back to our LGBTQ kiddos, they are not inherently prone to suicide risk, but because of their mistreatment and stigmatization in society, we do worry about them. And the Trevor Project is an excellent resource. They have a 24/7 call line where you can talk to someone who is in that community. Next, please. This is a great, fantastic resource. I want you all to write this down. It's called findhelpnow.org/Kentucky. It is updated at least weekly by the providers. So if you are looking for mental health treatment of any kind, of sort of substance use disorder or addiction treatment, for recovery housing, for naloxone, or just for learning materials and information, this is the place to go. You can actually put in the county where you're looking for services, the age and gender of the person, what their finances are in terms of what they could have available to pay or what coverage they have. And you can find out who has openings, either residential, partial hospitalization, or outpatient, to provide services. So please put this at the top of your phone list for a go-to place. Next, please. The other is the 988 Lifeline, and we are doing, I have to brag on Kentucky, we're doing better than almost every state in having statewide coverage, because our calls are being answered in every community locally by the CMHCs, we call them, the community mental health centers. Here in Louisville, that's 7 county services. Out in Lexington and surrounding counties, it would be New Vista down in E-Town, it's Communicare, so you know who your CMHCs are. They are answering those calls, and they are answering them in under 20 seconds. I think there was some initial concern that if someone called, they would be referred immediately to an ambulance would be called and they would be referred to law enforcement. That happens in fewer than 2% of the calls. They are adding text and chat features, and they've also added a easy dial. If you dial 1, you get somebody who can talk to you about as a veteran. Number 2 is for Spanish language, and number 3 is for LGBTQ folks. So remember 988, a lot easier to remember than a 10-digit number. Next, please. So I just want to talk for a minute as a psychologist. These are really difficult times, and I thought Kelly did a good job of kind of alerting us without setting our hair on fire. But these are really sad, and they're just difficult times. I know a lot of people that are just not listening to the news at all because they don't want to know the next shoe to fall or the next bad thing that's happening. So take care of yourself. If you're in a position, particularly where you are trying to take care of other people, whether in your job or in your home life, if you're a caretaker that Dustin talked about, remember the old adage in the airline, when the oxygen mask drops, put it on yourself first and then reach out and help those people around you that may need help. So keep an eye on yourself and look for changes like eating or sleeping too much or too little, irritability, easily crying or feeling sad, increased use of alcohol or the drugs, lack of concentration, not having the energy to get up and get out to do things, withdrawing and not and self-isolating. If any of these persist for 2 months or more, or even less time than that, if it seems fairly severe, check in with your primary care provider. Check in with a trusted friend or colleague to get some feedback. Mental Health America of Kentucky offers free online screening, and they can give you an excellent way of kind of getting a baseline for, I think they've got 24 different topics that you can do a self-assessment. So when in doubt, reach out for help. It's better to catch a problem early on, and you are very much worth taking care of. So do take care of yourself before you try to take care of others. And next, please. Oh, I'm ready to turn it over to my colleague, Priscilla Easterling. Hi, Priscilla.
Hi, Sheila. Thank you so much.
All right.
So I know just in the interest of time, we're going to skip through a couple of these updates. Next slide, please. We're going to mostly talk about a couple of Medicaid updates and then open enrollment, and then I will turn it over and let y'all go. So just a quick reminder that adult renewals are back to their regular cycle. Those are annual renewals. You get notices in the mail. Make sure to respond to those. Child renewals are supposed to restart in July 2025. There will be more information about that as we get closer, but the most important thing to know is just to make sure that your contact information is up to date. You can do that by logging into Connect yourself, call the hotline, or you can always reach out to a connector. There are free connectors in all 120 counties. Reach out and they can help you keep that information up to date. And keep a lookout in the mail for anything from the state and make sure to respond to it if you get it. Next slide. As Kelly mentioned, Anthem did exit as a Kentucky MCO as of the beginning of this month. Anthem does have to maintain operations to run out to continue covering and reimbursing any services prior to January 1st. They still have to process any claims from the last year from up to 365 days from service. And they also have to respond to any appeals for services prior to January 1st. So, if you had a service, they denied it, you can still appeal it, even though that they've left. There is a great transition website that's linked there, and there's a number that's specific for for any Anthem members who need some assistance during this time. We do know that folks who are dually enrolled in DSNP, DSNP as we call them, dual eligible between Medicaid and Medicare. There is supposed to be a special enrollment period potentially coming from CMS, but that's still pending approval. And with this new administration, we're just not sure about the timeline of when that will happen. But when that is approved, there will be a communication that's sent out to affected members. So next slide. Next slide, please. Next slide. You guys have seen all of these before. So just a good look at enrollment through the end of December. It's leveled off. Folks still need Medicaid. We still have over 1.4 million Kentuckians enrolled in Medicaid. It's an important safety net program. So next slide, please. There are monthly stakeholder meetings. The next one's February 20th. They do a high-level overview of all of the changes in Medicaid. Those are every third Thursday of the month at 11 a.m. And the registration information is there as well. Next slide. So great news, open enrollment did wrap up January 15th for the health insurance marketplace. As Kelly mentioned earlier, it was our highest open enrollment in 10 years, our second highest open enrollment in the history of the exchange. Our next slide will cover that. There were 97,734,000 Kentuckians who got plans this year. So that's very, very exciting. And I just heard right before this that there was a 127% improvement in the number of folks who enrolled from rural areas and from Hispanic, Latinx communities. So really exciting to see that. They're still digging into numbers. So really seeing that outreach working. And then Medicaid is always open for open enrollment. So if you need it, please apply anytime. Connectors are always available. And if you need help with Medicare, there are also SHIP coordinators available. Next slide. Like I said, 97,734 Kentuckians. I love that I remember that number off the top of my head. Just a quick reminder, I think Kelly did also mention it, there's that new pregnancy special enrollment period that started January 1st. It is actually integrated into the self-service portal, so you can apply through connect.ky.gov and become eligible to shop for coverage outside of open enrollment. There is that update about the DACA recipients. Unfortunately, there was a rule change, the Biden-Harris administration final rule change that was challenged by 19 states, including our Kentucky Attorney General Russell Coleman joined that lawsuit. And so that stopped the implementation of that rule change. And so unfortunately, it blocked the implementation of that rule that would allow DACA recipients and individuals and certain other non-citizen groups to enroll in qualified health plan. So we had a couple of weeks where that was effective, and then that was reversed. So bad news, we're still sort of watching it to see what happens. We know that it will be challenged, so we'll keep you up to date as we know more. Next slide. Outside of open enrollment, you can still get coverage through special enrollment periods. Here is a link to a great explainer about all of the different special enrollment periods that exist. And just a reminder that that change in financial assistance, a change in eligibility for it, if you become newly eligible, you can still get a special enrollment period throughout the whole year. So also reach out to a connector if you need help with that. Kelly also mentioned that the Family Fix is at risk in that opening session. What I did just hear that I wanted to make sure to say is that even if on a federal level that is repealed, Kentucky is already looking at an in-state option so that our state-based marketplace will recognize the potential eligibility for an unaffordable plan. Being offered an unaffordable plan through an employer could be looked at as a special enrollment period. So they're currently working with insurers to sort of shop that and figure out if that's a viable option. But there is hope that at least on a state level, we might be able to enshrine that protection. So that's a great update. And with that, always a reminder, be careful of junk plans and scams and all of that. Again, if you need help, reach out to a connector. So with that, turning it back over to Kelly. Thank you.
Thank you for hanging with us a few minutes over time. We won't go through the resources slides here. Just please know that when you get the slide deck tomorrow in an email, these are available to you. If you have any questions, I know we covered a lot in a short period of time. Please let us know. how we can support you or answer your questions moving forward. And we'll see you next month. Thank you.